Ladies and gentlemen, a warm welcome to all at the PCQuest HealthTech Forum. COVID showed the true light where we are in terms of medical infrastructure, preparedness for the future. But one thing I must say, COVID has also opened the doors of opportunities for all, where technology took the center stage and marvelous interventions are taking place at a rapid pace. Today at PCQuest Health Tech Forum, eminent leaders and professionals will share their valuable insights and also emphasize on how technology should be revamped and made to good use for humankind. I would like to now invite Professor Randeep Guleria, Director AIIMS New Delhi, for a very special address. Professor Guleria has done pioneering work in respiratory medicine and has several awards and honors to his credit. He is the first Indian to get a Directorate of Medicine in Pulmonary and Critical Care Medicine and was conferred with the prestigious Padma Shri Award in 2015. He is also a member of many key committees in the Government of India, including the Joint Monitoring Committee to monitor outbreaks of new diseases.
First of all, let me really thank PCQuest Health Tech for inviting me as a key speaker. I'm really delighted to be here. I think the topic that they have and the discussion that we're having today are very, very relevant, especially because of the pandemic and the lessons that we've learned during the pandemic. I think when we had the pandemic, when we start looking at healthcare and technology, we were really lagging behind as far as technology was concerned in healthcare. And that was because of multiple factors, predominantly a reluctance by health professionals to really adopt technology and change their ways, as has happened in many industries across the board. But I think all of that changed in the COVID era. And therefore, a lot of changes happened during the COVID, which really pushed the frontiers as far as health technology or technology in healthcare was concerned. First of all, because of the lockdown and the challenges that we had because of the lockdown, teleconsultation became something which was very, very important because patients could not really come to the OPD because of the fear of getting COVID. The lockdown had restrictions itself. And secondly, people with COVID did not know how to really reach out and find out the do's and don'ts in terms of management. And therefore, in March 2020, the government came out with the telemedicine guidelines, which actually had a framework and in a way legalized teleconsultation so that people could really get teleconsultations in a proper format. I think that was a huge step. And to take it forward, the government actually started the eSanjeevani program, which is also promoting teleconsultations across the country. And this is also doing very well. Digital health and technology was already there to some extent in healthcare. Ayushman Bharat is one example where technology has been used to provide care to a large number of Indians and who need in-hospital care. But I think along with that, we realized the importance of technology, and this actually led to a lot of advantages that we were able to really build in. One was when we had the huge surge of cases in the pandemic, using technology, one was able to really reach out to various hospitals. We at AIIMS started what we call eICUs, and we interacted with hospitals across the country. I myself probably have interacted with more than 550 hospitals, talked to doctors there, discussed management of COVID in ICU and sick patients, and came out with proper guidelines, support, and advice to people. And this led to the concept that we could even use this subsequently in the form of doctors who are present in one place being able to advise physicians who are not specialists in that area. You may not be a critical care specialist, but if you have a sick patient in an ICU, by using an eICU concept, you can see the patient's parameters, you can see the patient's virtually, you can see what are the drugs that the patient is getting, and be able to give comprehensive advice in terms of patient management without being physically present there. And by this way, specialists who are present in limited numbers could really advise a huge number of patients or hospitals as far as patient care was concerned. So I think this was a big step, and this became something which was acceptable and would really be useful even in the post-COVID era. Similarly, the use of artificial intelligence, neural network became very, very useful for people to really manage patients and to see how they could really start looking at various ways of being able to predict whether a person has COVID or not, or whether this is going to go into more severe illness, and how this could be taken to a next level in other illnesses also. I think this has a lot of advantages. We also then had this promotion by the government of the digital health mission, which in my mind can be a game changer, because this will allow everyone's digital health to be literally carried like an Aadhaar card. And this, if we can really get all the private sector and the public sector on board, then no matter where the patient goes, to the private sector, to the public sector, his health records will go with him, and therefore this will really avoid duplication. And as we move towards more and more non-communicable diseases in our country, diabetes, hypertension, stroke, chronic respiratory diseases, the digital health record becomes very important, because you have these diseases which are there for life. A diabetic has diabetes for life. A patient with hypertension has hypertension for life. And you need monitoring and close observation so that complications don't happen because of these diseases. We don't want person to develop diabetic retinopathy or diabetic nephropathy leading to chronic kidney disease and dialysis and transplant, or heart failure or stroke happening because of uncontrolled hypertension. So I think the digital health mission and this will really take things to a new level. Also, this technology can be used using artificial intelligence to be able to see whether we can use telehealth. Can we use devices like Fitbits, which patients have, and they can actually monitor patients remotely, and using artificial intelligence and algorithms, be able to predict an event before it happens. You have a person whose heart rate suddenly starts going up, his saturation starts falling, or there is some irregularity noticed in the ECG. Could that predict that this person is going on to an acute event? And therefore, an alert could be sent to the patient, to the doctor, even to the nearby hospital. And thereby, you could actually save lives, and it could be very useful. I think this is the next level that we need to really go forward. And there has to be training of the workforce, in my mind, if all of this gets adopted. One of the reasons why we were not able to have transformation in healthcare as far as technology was concerned is because we need to get everyone on board, especially the users. And I feel that whenever we have technology coming in, it has to be user friendly. So doctors who are going to really feed that data in, who are going to use this, have to be comfortable with it. Other healthcare workers, even whether it's an ASHA worker, has to be comfortable with the technology that we're trying to use, and they should be able to accept it, and it should be user friendly. At the same time, this technology could really help allied professionals who may not be healthcare professionals per se, help the system in providing care to patients who are in rural India and remote areas where healthcare is not up to the standard. And by this, we could actually improve healthcare in that area. So I think there is a lot that can be done as far as health and health technology is concerned. And therefore, I think we are in a position where we need to push it forward. COVID has taught us a lot as far as the utility of health technology is concerned. I just hope that we're able to sustain it as we move away and start seeing COVID becoming from a pandemic to an endemic disease. The lessons that we've learned during the pandemic of the power of technology in healthcare should get translated to long-term sustainable solutions that our country needs in terms of healthcare in remote areas, in rural areas, so that there's equity in healthcare. Currently, there is a lot of imbalance as far as healthcare is concerned in, let's say, secondary and tertiary cities as compared to smaller towns and in rural India. That inequity we need to correct, and we need to develop a mechanism that healthcare is there irrespective of socioeconomic status. No matter what be your status, you are provided good healthcare so that quality of life is good, and at the same time, the workforce remains healthy. So we focus also on preventive health. In our country, the focus, I think, also has to be a lot on preventive health, and health technology can really help in educating people, in making sure that preventive health steps are there, and for early diagnosis. In rural India, people don't get their blood pressure checked until they have a stroke. They don't get their blood sugar checked. So if we were to use technology to be able to do this, so that we are able to screen patients, whether it be for chronic diseases or even for cancers, 60 to 70% of cancers are preventable. And many cancers, if detected early, are curable. But unfortunately, in our country, most cancers come in a late stage, because of the fact that we haven't really focused a lot on preventive and early diagnosis. So I think that is where technology can really make a huge difference. And I really would congratulate the PCQuest Health Tech meeting that is being held here. And I am sure that this will really go a long way in getting people to brainstorm and find solutions which are sustainable and could really be a game changer as far as healthcare in our country is concerned. Thank you very much.